We'll now move on to oral questions put by members to ministers. The Honourable Leader of the Official Opposition.
Thank you, Mr. Speaker. My question through you is to the Premier. Earlier this year, the government announced that it would be adopting all of the recommendations from the Glaze report and immediately moving forward with 11 recommendations. Among these is the recommendation to eliminate all the English language school boards and centralized decision-making within the Department of Education. It does require that the democratically elected school boards be disbanded in favour of inaccessible department officials. The skepticism, Mr. Speaker, is justified. It echoes this government's decision to amalgamate the Regional Health Board into the much discombobulated Nova Scotia Health Authority. My question is, why does the Premier insist on subjecting the education system to the same failed experiment that has thrown the healthcare system into a crisis?
The Honourable Premier.
Thank you, Mr. Speaker. I want to thank the Honourable Member for the question. I want to thank all those hard-working educators across the province. She knows we've heard from parents, we've heard, quite frankly, from teachers, we've heard from administrators. The current structure wasn't working. This was about providing a structure that works. The bill that is introduced today ensures that we have site-based management, that principals and vice principals can do the job, Mr. Speaker, that they want to do, which is manage the schools and ensure that the quality of the education that all of us want for our children, that they want for our children, will be there in place. We're going to continue to work with those educators to make sure that we transform the administrative side of this education so that we then can implement the inclusion report that will be coming, Mr. Speaker, and our budget will reflect our commitment to that report.
The Honourable Leader of the Official Opposition.
Mr. Speaker, that answer is obviously a pattern that we have seen. It's all too familiar. There were concerns about health care, and this Premier pointed the finger at other agencies with the stroke of a pen, amalgamated the health boards. Not long after, we had a record number of Nova Scotians without a family doctor, patients dying in hallways, and healthcare professionals screaming for this government to wake up and notice that the system is absolutely in a crisis. The Premier again has turned his eye to other agencies. This time it's the school boards, and he is blaming them for the problems. Will the Premier please acknowledge that his plan to centralize the education system is marching our students down the same path that has created the current crisis in our healthcare system?
The Honourable Premier.
Mr. Speaker, the Honourable Member should read the report, Mr. Speaker. It's not centralizing, Mr. Speaker. It's actually giving site-based management back to principals and vice principals, Mr. Speaker. It's the very thing that successive governments have heard from administrators, Mr. Speaker, for a decade or more. The fact of the matter is that central offices are making decisions for schools. Quite frankly, what we've done today, Mr. Speaker, and I hope with the support of the opposition, is we've given principals and vice principals and education leads on sites to make decisions for their students and for their school community. And Mr. Speaker, as part of this report, the school advisory councils will be enhanced to give that local voice, the input, Mr. Speaker, from parents and community leaders, not those from neighbouring communities or neighbouring school communities, those from the existing school communities, to ensure that the kids in those communities get the education system base that they deserve.
The Honourable Leader of the Official Opposition on her final supplementary.
Mr. Speaker, that's not the narrative that the majority of Nova Scotians have. Really, Mr. Speaker, it is that our teachers and educational professionals have not waited for a crisis. They've been sounding this alarm for a long time. They are trying to alert the Premier, Mr. Speaker, to the dangerous impacts of centralization. They are asking the Premier to come forward with a plan that doesn't put government on one side, the teachers on the other side, and unfortunately the parents and students right in the middle. In order to hear from students, parents and teachers and school board members, will the Premier commit to a full round of public consultations specific to the Glaze recommendations before they are implemented? The
Honourable Premier.
Mr. Speaker, I want to tell the Honourable Member that the Minister has travelled this province talking not only to teachers, to principals, Mr. Speaker, to SAC, Mr. Speaker, and unlike that party, Mr. Speaker, we're going to fix the challenges facing this province. For too long, we've gone out and asked for reports and let them sit on a shelf. We're acting.
The Honourable Leader of the New Democratic Party.
Thank you, Mr. Speaker. Mr. Speaker, nothing about the government's modified plans for the Glaze report announced this morning does anything to address the dismay there is across Nova Scotia about the loss of local elected school board voices and their replacement with a super centralized bureaucracy in Halifax. Mr. Speaker, given how badly his super centralization has worked out for patients in health care, can the Premier explain how eliminating local voices will make any meaningful improvement for kids in schools?
The Honourable Premier.
Mr. Speaker, again, I want to encourage the honourable member to read the report and have a chance to look at the bill. As a matter of fact, what happens is we're giving more decision-making to education leads in schools, and quite frankly, we're asking community members to continue to work on the SACs across this province, which many have been, Mr. Speaker. What we're going to provide in this bill is an opportunity for some funding for them to make decisions that impact the individual children and the learning environment that they're in. At the same time, administrators will manage and lead the schools across this province from an educational point of view to ensure that it reflects the reality of the communities they're in.
The Honourable Leader of the New Democratic Party.
Mr. Speaker, what I'm speaking about is elected local voices, and it is difficult to understand why the government should have such a difficult time to fathom why this is a matter of such concern to people across the province. Elected local voices. Consider Jennifer Raven from the Halifax Regional School Board. Through her efforts, amongst other things, every morning now in Halifax area schools there is a land acknowledgement, and there is the first report on racism and discrimination through her has been initiated in Halifax schools. Ms. Raven reports in the media today that she's afraid her work's being tossed aside. Why wouldn't she be afraid her work is being tossed aside? That's exactly what's happening to her and the other members of the school boards.
The Honourable Premier.
Is there a question? Is there a question?
The Honourable Leader of the New Democratic Party.
Go ahead.
Why would Ms. Raven not feel tossed aside, given exactly the treatment the Premier and his government have given to her and other members of the school board?
The Honourable Premier.
Thank you, Mr. Speaker. I want to thank the honourable member for the question. Mr. Speaker, I want to thank not only Ms. Raven, but all school board members across the province who have been working on behalf of students in this province. The fact of the matter is the administrative model has not worked. We've heard from teachers, we've heard from administrators, Mr. Speaker, that the current structure was not working. We hired someone to come in to do a report. They provided a path forward. Mr. Speaker, one of those recommendations was the elimination of school boards and a fractured system across this province. We've embraced it. There were other recommendations that we took out and we talked to school communities, we talked to administrators, we talked to teachers. They've been adjusted to reflect some of the concerns that we had, but we believe we have in place now, and we will after this bill passed, an administrative model that will allow us to implement the recommendations that will come from the inclusion report that will really impact students and classrooms across this province. And I'm looking forward to working with educators to ensure we do just that.
The Honourable Leader of the New Democratic Party on his final supplementary.
Mr. Speaker, is precisely the impact and benefit and lack of benefit on kids in classrooms that is at issue. I was moved by a recent email from a young teacher, Ria Tebow. She writes, "I'm not strong enough to endure the hate that the government continually spews at me. I'm so proud of what I do and accomplish in the class, but I can't support my students if the government doesn't allow me to do my job to the best of my abilities." Mr. Speaker, the education changes being proposed do not do one thing for the situation of kids in classrooms Ms. Tebow is writing about. So here's the question. How dare the Premier present the wiping out of local voices as though that were an answer to the desperate challenges experienced by the teachers in Nova Scotia?
The Honourable Premier.
Mr. Speaker, I want to thank the honourable member, and I want to communicate directly to Ms. Tebow. Mr. Speaker, this piece of legislation today will eliminate all the barriers between the Minister of Education and her classroom, and I want to assure Ms. Tebow and all teachers across this province, this government has heard what they've said about their classroom. When the recommendations on inclusion are announced, Mr. Speaker, our budget will reflect our commitment, and we'll have an ongoing commitment with teachers across this province to address the very issue they've talked about, which is inclusion. And this bill will give us a direct path to their classroom to work directly with them.
The Honourable Leader of the Official Opposition.
Thank you, Mr. Speaker. My question is for the Premier. 100,000 Nova Scotians without a family doctor. My family's actually within that 100,000. 100,000 Nova Scotians need a family doctor. Yesterday, I asked the Premier how many doctors Nova Scotia had lost since the fall, and he told me how many doctors Nova Scotia had gained since the spring, and I believe the amount was around 100. Can the Premier tell the people of Nova Scotia if the province experienced a net gain or a net loss of doctors in the last year and the magnitude of that net gain, net loss?
The Honourable Premier.
Mr. Speaker, I want to thank the Honourable Member for the question. What I said yesterday, we had 100 new doctors since April. I think the Minister of Health corrected me. I think it's 110. We're going to continue to work with communities across the province. I want to thank the Minister of Immigration, who's brought in a new pilot program that will allow us to bring medical professionals right into our system. We're continuing to work with doctors in Nova Scotia to address the challenges facing some communities, and I'm looking forward to continuing to move this province forward.
The Honourable Leader of the Official Opposition.
Thank you, Mr. Speaker. Maybe the Premier can table that list of 110. That's an exact number. That's great. Where are they? Nova Scotians have real, unaddressed health care needs. They will sleep better when they are certain that they have access to the primary health care provider they both require and, more importantly, deserve. But the gain or loss of doctors isn't the only figure that will tell the story of our healthcare crisis. The more important figure tells us whether the people are getting the care they need. So my question for the Premier is, how many Nova Scotians have been removed from the family doctor wait list in the last year?
The Honourable Premier.
Mr. Speaker, I don't know in the last year, but I think it's about April. I think it's been about 8,000.
The Honourable Member for Dartmouth South.
Mr. Speaker, my question is for the Minister of Education. Over the last 2 days in this House, the Minister has insisted that his focus is on all students. However, his government's disappearing of the democratically elected school boards and their dedicated African, Nova Scotian and Mi'kmaq representatives will do nothing to improve the situation for our kids in classrooms and will not address what parents, teachers and students have been calling out for. Can the minister point to a single provision in this hastily compiled enormous omnibus bill, not some future plan or future initiative, that will make one difference for my and other children in classrooms?
The Honourable Minister of Education.
Thank you very much, Mr. Speaker. I can name several. Fixing the administrative structure, which has led to different achievement outcomes from one region to the next, is a problem that this will help fix. Having more resources go from central offices into classrooms will help. Having a rural education strategy to meet the needs of those in the extreme areas of our province will help, Mr. Speaker. Enhancing the voice of African Nova Scotians and Mi'kmaq in the department with executive director positions that will be permanent and focused on the achievement gap that we have been unable to fix despite the fact that we've had representation on our school boards, Mr. Speaker, will have a direct impact. Empowering our teachers to have more say over course materials, curriculum, giving our principals the freedom to be without conflict of interest, to focus on the needs of our kids, Mr. Speaker. All of these things will directly impact our kids for the better.
The Honourable Member for Dartmouth South.
Notwithstanding the self-serving applause, I heard nothing on that list that has been requested by teachers, students, or administrators. Mr. Speaker, what we've learned from the elimination of local health authorities is that centralizing decision-making has not improved patient care or resulted in greater focus on health and wellness. What it has done is left communities fending for themselves without services that meet local needs and has created constant questions about who is accountable for decisions. Now we're getting ready for the same issues in our education system. Mr. Speaker, given what is at stake and our experience in healthcare, why won't the minister pause this bill to consult with, rather than dictate to, which is my interpretation of what's happened so far, local communities about what is needed in classrooms?
The Honourable Minister of Education.
Thank you very much, Mr. Speaker. In fact, the objectives of this report, of this legislation, I believe are reflective to the primary concerns that we have heard. And this will help us implement an inclusive education policy that will better improve the classroom complexity challenges that teachers have been dealing with, Mr. Speaker. It's so interesting that for a year, I've been hearing from the opposition that's told us this system is in crisis, the education system is broken. And now that we are on the verge of having the single greatest reforms that have happened in this province's history in education, they have become defenders of the status quo.
The Honourable Member for Kings North.
Mr. Speaker, my question is for the Minister of Justice. Mr. Speaker, after months and months of delay and silence, in December we finally learned about this government's plan to sell marijuana to Nova Scotians. Imagine our surprise to learn that the Minister of Justice chose to ignore explicit advice of the Health Canada Task Force on marijuana legalization. That task force said, quote, jurisdictions should avoid and strongly discourage co-location of retail cannabis and alcohol or tobacco sales wherever possible, and I will table that. The minister took that advice under advisement and proceeded to set up marijuana boutiques in existing provincial liquor stores. My question for the minister, what independent peer-reviewed analysis did the minister conduct to allow him to throw out Health Canada's explicit recommendations on the retail sales of marijuana?
The Honourable Minister of Justice.
Thank you, Mr. Speaker. And that report was actually a group assembled federally, not Health Canada, but a group assembled federally. And what the report said, Mr. Speaker, what my colleague has omitted, is they said if you are going to co-locate, ensure you place these safeguards. No co-location in the same space, so separate facilities. We're doing that, Mr. Speaker. As far as training available to staff, important that they understand. Signage, Mr. Speaker, that speaks to the challenges of co-use. These are the types of things, Mr. Speaker, that the report actually identified, that if a government chose to co-locate, ensure you place these safeguards. We plan to do that, Mr. Speaker.
The Honourable Member for Kings North.
Mr. Speaker, I'd like to thank the minister for that answer. Mr. Speaker, Nova Scotians are very worried that selling alcohol and marijuana in the same store could lead to an increased cases of impairment while driving. Encouraging the combination of alcohol and marijuana could also lead to unpredictable impairment effects. The threat to public safety is so serious that all U.S. states that have legalized marijuana have banned co-location. Nova Scotia is alone among Canadian provinces in selling marijuana through existing liquor stores. My question for the minister is, will the Minister of Justice admit that his is a flawed approach and commit to reviewing the decision to co-locate marijuana and alcohol in the critical interest of public safety?
The Honourable Minister of Justice.
Thank you, Mr. Speaker. Mr. Speaker, one of the strengths of the Nova Scotia Liquor Commission is in fact their social policy and the training that they have undertaken, the extensive training, Mr. Speaker, that they have undertaken in the sale of a regulated product. They are the environment, Mr. Speaker, that best positions Nova Scotians to protect the health and safety of our youth and to mitigate the illicit use of the cannabis substance, Mr. Speaker. We believe we are on the right track. We have had constructive feedback, Mr. Speaker, that this is the right direction to go. As a matter of fact, Mr. Speaker, I met with the President of Mad Canada this week, and the President of Mad Canada has endorsed our model over and above the models of every other province in this country.
The Honourable Member for Inverness.
Mr. Speaker, this week we saw the tabling of the federal budget. And last session, our caucus stood up and acknowledged and raised awareness of flaws in proposed changes to the Federal Income Tax Act. And Mr. Speaker, we didn't need a weekend at a chalet in Provence to know that it was going to hurt small business. Mr. Speaker, the federal government has backed off on some of those changes, but we know that professional corporations are still going to be targeted. And in our province, 75% of physicians are fee-for-service, and or 75% of them are incorporated, which probably suggests they're fee-for-service. They're paying more tax in this province already than other provinces. We could lose them. Has this government considered the need to increase fee for services? I direct this question to the Minister of Health.
The Honourable Minister of Health.
Thank you, Mr. Speaker. As we continue our work with the federal government, as the member knows, we've had conversations with the federal Minister of Finance. I did. The Minister of Finance had those conversations as well. The work that goes on is fee-for-service initiatives within the family physician space for physicians when they're billing for their services being provided on behalf of Nova Scotians in the primary health care system. Thanks.
The Honourable Member for Inverness.
Well, Mr. Speaker, I didn't really hear an answer there. This is a serious problem. Mr. Speaker, many of our new doctors especially are on salary. It won't affect them. But more of our doctors are on fee-for-service. They're not looking at, when they're doing their income taxes this time of the year, they're comparing what they're paying in this province for income tax and what they could be paying in other provinces. This could be another nail in the coffin of many of those doctors because they may choose to move elsewhere. It's a federal change, but it has impact for our province, both for retention of doctors, but also for taxpayers. Because if this government, in response to the federal changes, has to raise those fees for service, that means Nova Scotians are going to be paying more for their health care services. So, Mr. Speaker, has the minister completed an analysis of what the potential cost to the taxpayer might be?
The Honourable Minister of Health.
Thank you. Thank you, Mr. Speaker. I thank the member for the question. As the federal government's budget just came down a couple of days ago, no analysis hasn't been completed yet, Mr. Speaker, but certainly we work with the Department of Finance, the Minister of Finance staff to analyze all details and aspects of the budget and how it would apply or impact the province of Nova Scotia, not just for our healthcare services, Mr. Speaker, but for all programs and services that we offer throughout the province. Thank you.
The Honourable Member for Cumberland North.
Mr. Speaker, have you heard of the latest Twitter campaign? It's #CodeCritical. And it's being done by our paramedics who are desperate for this government to hear their voices. They are tweeting #CodeCritical to try to get the government's attention because of the unsafe situations around our province. Last evening, for example, last Friday evening, the safety of the emergency health services in the northern region was in jeopardy. There was one ambulance, Mr. Speaker, between New Glasgow, Truro, and Spring Hill. Paramedics Union have said that this is becoming more and more common, and there's a huge part of Nova Scotia without adequate coverage. Does the Minister of Health disagree with paramedics, #CodeCritical, or does he share their concerns that these offload delays for ambulances are contributing to the healthcare crisis in Nova Scotia?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I thank the member for the question. And indeed, I believe, like all members in the legislature here, and I know we have some former paramedics that are here on the floor with me, Mr. Speaker, from several parts of the province. And I believe, first of all, I'd like to recognize the great work that our paramedics provide on behalf of all Nova Scotians. As far as the concerns, Mr. Speaker, being raised by paramedics, in particular the union representing paramedics around offload times and the impact that has on availability of services. Indeed, that's something I've asked staff to prepare a report, some recommendations for me to see what steps we can take to improve our efficiency in that area. Thank you.
The Honourable Member for Cumberland North.
It's time for this government to listen. There's too many unsafe situations. We need to look at what is the source of this problem. There's no hospital beds, so our emergency rooms are full, backlogged with admitted patients lying in the hallways and sometimes dying. It's time for this Minister of Health and this government to take these problems seriously and help find solutions. So my question to the Minister of Health is, it's one thing to recognize #CodeCritical, but what is his department actually going to do to solve this problem so that our ambulances are not waiting up to 11 hours to unload patients to the Emerge department?
The Honourable Minister of Health.
Thank you, Mr. Speaker. As I'd mentioned previously to the last question, Mr. Speaker, indeed, I did listen. I do listen. I've asked for a report and some recommendations from staff to look at exactly those challenges that the members highlighted. What can be done to help improve the situation? That's part of what we do and what we expect within our healthcare system, both within the Department of Health and Wellness, but also with our partners in our health authorities, the NSHA, the IWK, and our other partners like EHS providing ambulance services. And it's by working together, Mr. Speaker, we can come forward with solutions to the challenges that we face. Thank you.
The Honourable Member for Cape Breton Centre.
Mr. Speaker, yesterday, when asked about the QE2 redevelopment project, deals with the long-term care, how it deals with the long-term care beds in Nova Scotia and its ageing population, the Deputy Minister of Health told the Public Accounts Committee that questions around long-term care are entirely separate from the hospital redevelopment, leaving me to assume that there will be no new nursing home beds as part of this health system overhaul. which almost doesn't make any sense. But, Mr. Speaker, regardless, can the minister explain why, at a time when nearly 1/3 of our acute care beds at the Dartmouth General Hospital are filled by people waiting for long-term care beds, why there are no new plans to add nursing home spaces in our healthcare system?
The Honourable Minister of Health.
Thank you, Mr. Speaker. I thank the member for the question and the interest in the ongoing QE2 redevelopment project, Mr. Speaker. This is an ambitious and important project for the province. It's one of the largest public infrastructure projects this province will have embarked on in several decades towards in particular, our important healthcare system, Mr. Speaker. The question asked and the purpose of this redevelopment is to focus on the services that are being provided in the existing facility and how we respond to the needs of the community for those services being provided at that site, and how we're going to distribute that at sites across the province, Mr. Speaker. So as responded at public accounts that indicated that was not a long-term care facility, so that's not part of that redevelopment project.
The Honourable Member for Cape Breton Centre.
Mr. Speaker, how can we look at rehauling a healthcare system when we're not looking at one of the crucial problems, which is long-term care beds? Positive thinking won't stop Nova Scotians from growing old. Optimism won't change our demographic situation. We are going to need nursing home beds whether the government likes it or not. Reality isn't always rosy. Sometimes it's negative. Home care is a crucial service, but to build the entire continuing care system on it doesn't make any sense. We all know seniors who need more than home care can offer. Like it or not, reality is reality. Mr. Speaker, does this Minister of Health really believe that we do not need new nursing home beds?
The Honourable Minister of Health.
Thank you, Mr. Speaker. And as the member cited in her remarks, a significant effort is being made in the province and has been in our first term in government, focused on our home care policy based on a home first process, Mr. Speaker. That's a phase 1 initiative. The first point was to target and focus on providing the care for people in their homes, which is preferred, and provide good care for them, Mr. Speaker. Once that initiative is underway and rolled out, Mr. Speaker, that allows us to get a better assessment as to what the actual care requirements would be within the long-term care facilities, Mr. Speaker. That's part of the ongoing work of our continuing care strategy. Thank you.
The Honourable Member for Cumberland North.
Mr. Speaker, every week I have more than one senior contact me because they cannot afford their medications, even though they pay into the Pharmacare, senior Pharmacare program. One gentleman, for example, is on a drug called Xarelto. It's a blood thinner. And his family physician and his cardiologist want him on this drug. He has been denied and told that he has to go, think about this, there's no common sense. He has to prove that he needs this drug. And to do so, he has to go off of the drug, take a risk of having another heart attack or stroke to prove he actually needs the drug. Can the Minister of Health please explain why the formulary excludes types of medications such as this and puts patients at risk?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I appreciate the member's question. Really what this question delves into is the process by which drugs are assessed and selected to be or not selected to be added to the provincial formulary. Mr. Speaker, it goes through a very extensive process focused on clinical reviews that get conducted at the national level, Mr. Speaker, and recommendations come forward with these drugs after that extensive review, and they make recommendations as to the clinical circumstances and whether to list with or without conditions, Mr. Speaker. I suspect in the specific case that's being raised by the member that it does tie to conditions that should be met before being considered for coverage, Mr. Speaker. So that would likely be the case in this particular one, but I assure her that it actually goes through an extensive review for consideration by clinical experts.
The Honourable Member for Cumberland North.
Yes, so he has been told, like I already mentioned, Mr. Speaker, he has to actually go off this medication that his cardiologist has put him on and does not want him on warfarin because it's a superior drug in order to prove that he needs the Xarelto. Keeping in mind, Xarelto means you do not need to have any lab work and your physician does not have to monitor your INR levels weekly. So I would encourage the Minister of Health to look more closely at these kinds of medications and not just look at the cost of the drug, but look at the cost of the lab and the physician services, the overall cost to the patient and the healthcare system. So, Mr. Speaker, will the Minister of Health commit to reviewing these excluded drugs most commonly prescribed to determine if the formulary should possibly be updated?
The Honourable Minister of Health.
Thank you, Mr. Speaker. And the member made a question or a suggestion that we review the drugs or the total cost side for drugs. As I mentioned in my first response, Mr. Speaker, the very first step in assessing and determining whether drugs are considered to be added to our formulary is a clinical one, Mr. Speaker. It's an assessment of a particular drug and the performance of that drug based upon its actual efficacy. That is the actual benefits and success rates based upon clinical assessment of healthcare professionals, Mr. Speaker. That's the first step. And when compared to other types of drug treatments, whether or not it is superior or not is a first step, and that is probably the most important step, even prior to even considering financial aspects. Thank you.
The Honourable House Leader for the Official Opposition.
Thank you very much, Mr. Speaker. Thought it was apropos to wear my Barrington Municipality tie today as I asked this question. My question today is for the Minister of Transportation regarding the Cape Island Causeway. So for a number of years, residents in the area have expressed concerns that erosion was threatening the structural integrity of that causeway. Now, I raised this question, I believe, in the spring of last year, the fall of this year, so it's been something that I've come to the House with on a number of occasions. Department staff were soon out addressing that situation, and I want to thank the Minister for his response. So my understanding is the Department has completed some drilling to determine the soundness of the causeway. So can the Minister provide an update on the findings to date and the current status of the causeway that opened on May 1st, 1949?
The Honourable Minister of Transportation.
Thank you very much, Mr. Speaker, and I really appreciate the question, and especially in drawing the House's attention and the attention of Nova Scotians to the wonderful community of Cape Sable Island, which is one of Nova Scotia's unique, iconic communities, and indeed stands out in Atlantic Canada. As the member mentioned, in 1949, the Solutions to Transportation Issues made the choice to take on that unstoppable force, which is Mother Nature. In the instance of that causeway, and thank the member for bringing this forward, we met with the community, we met with the local councillor, we've dispatched our people down there to view this very seriously to determine what the solution is going to be. We haven't got the actual report back yet, but I'm expecting it in March.
The Honourable House Leader for the Official Opposition.
Thank you very much, Mr. Speaker. And I want to thank the Minister's attention on this matter. For the people of Clark's Harbour, the Hawk, Clam Point, the rest of the residents of Cape Sable Island, the causeway is their only link to the mainland. And while they would welcome work on the causeway, the disruption is something that they would certainly prefer to plan for. So can the Minister share any plans or next steps for the project that will allow me to assist those residents in planning for any disruption in travel that they might experience?
The Honourable Minister of Transportation.
Mr. Speaker, depending on the results of the report and the extent of the remediation that might be required, we would commit to doing a public meeting in the area to explain to them what's going to happen. That's only normal that you would do that. Thank you.
The Honourable Member for Sydney River Myra Lewisburg.
Well, thank you very much, Mr. Speaker. And Mr. Speaker, my question through you is to the Minister of TIR as well. Mr. Speaker, last summer we had a major failure of some infrastructure in the community of Manitou. It's known as the Myra Gut Bridge. And the Myra Gut Bridge is between the communities of Manitou and Portmorion, and it's a major transportation link on the Marconi Trail. The bridge itself was about 150 years old, and it finally failed. A couple of days ago, the Minister of Transportation stood in this House and spoke with great warmth about the beauty of Manitou and how everyone should visit there. Last year, when I asked him this question, he told me that at that time, an in-depth engineering study is currently underway as to how to fix the bridge. I wonder if the Minister could provide an update on that in-depth engineering study.
The Honourable Minister of Transportation.
Indeed, Mr. Speaker, we do have a commitment to that repair. the House should understand that that was a railway bridge at one point, and it's when it was built, and it was converted to a highway bridge later on, and so it's a bit of a hybrid in terms of what's happening. The key area there is the involvement of the federal government in terms of the transportation access on the water through there, and we're working with them, and that will feed into the information that we would need for the design, Mr. Speaker.
The honourable member for Sydney River Myra Lewisburg.
Thank you very much, Mr. Speaker, and thank you for the answer. And it is my understanding NAVCAN has some input into how this takes place and the height and of the type of bridge that needs to be built. So my question is, could you describe to us, for the people of the area, when the proposal for NAV Canada was submitted so that people can understand why the timeline of fixing the bridge is so long?
The Honourable Minister of Transportation.
Thank you, Mr. Speaker. I will get that information for the member. I'm not sure what the stage it's at. I talked to my people this week, and they're working with NAVCAN to design the kind of access that's going to be required, because there are fishing boats that go through there. Thank you.
The honourable member for Truro, Bible Hill, Millbrook, Salmon River.
Thank you, Mr. Speaker. My question today is for the Minister of Environment. This week we learned that there's been yet another spill from a broken pipe at Northern Pulp, this time of ash slurry. And I'll table that, Mr. Speaker. Last year, the mill failed 3 emissions tests. I'll also file that. And in 2015, the mill spilled millions of litres of toxic effluent onto Pictou Landing First Nations land, which I actually saw myself and took pictures. So these are just the recent incidents, Mr. Speaker. And without a rigorous Class 2 assessment, I can understand why Nova Scotians are skeptical about Northern Pulp's new plan for a pipe in Northumberland Strait. So my question for the Minister is this. Will the Minister commit today to a Class 2 environment assessment so that more environmental damage is avoided before it's too late?
The Honourable Minister of the Environment.
Thank you, Mr. Speaker. I want to thank the member opposite for the question. As I said last session in this House, that the project for the new effluent treatment facility at Northern Pulp qualifies for the Class 1 assessment. That decision was made. We continue to engage our federal colleagues, and they will be involved in the process in terms of how the project unfolds. It's not yet registered yet. And I want to thank the member for highlighting the compliance action that the Department of Environment takes. I want to thank the inspectors for going out and issuing the directive. It's something that this government takes very seriously, and we will continue to do so. Thank you, Mr. Speaker.
The honourable member for Truro, Bible Hill, Millbrook, Salmon River.
Thank you, Mr. Speaker. Well, I'd like to be able to thank the Minister for stopping the pipe action, if he could. Nova Scotia's fishers and First Nations people are all uniting to say clearly that what this Liberal government is doing is just not enough. The Department of Environment likes to point to the voluntary community consultation that Northern Pulp is doing, but given the mill's history, community members have been skeptical, and now that process is broken down completely. So with fishers saying that they'll be on the water blocking any construction if this pipe is approved. So the government could address this impasse, Mr. Speaker, with a Class 2 assessment or by simply saying no pipe. So, Mr. Speaker, if the minister won't commit to a Class 2 environment assessment, can he guarantee today in this House and to all Nova Scotians that a pipe pumping 1 billion litres of pulp mill effluent into the Northumberland Strait won't harm the residents, the fishing and our tourism industry?
The Honourable Minister of the Environment.
Thank you, Mr. Speaker. Let's be clear why we're here. We're here because we need to clean up boat harbors. Successive governments have not addressed that issue. There's commitments made 4 times. The commitments have been made by the province of Nova Scotia that that facility would close. This government intends to meet that commitment, and it does require a new effluent treatment facility, so I'm not prepared to say no pipe. It's easy to say that you're on both sides, and if you want the mill to close, then you should just go ahead and say it. This project is an important project for the province of Nova Scotia, and we will keep our commitment. It's the #1 example of environmental racism in this province, and we will meet that commitment.
The honourable member for Queens Shelburne.
Mr. Speaker, my question is to the Minister of Fisheries and Aquaculture. The minister likes to boast about all of the aquaculture regulations he has implemented as Minister of Fisheries and Aquaculture. On multiple occasions, both inside this House and in the media, the minister has claimed there was minimal damage at the Jordan Bay site. Only 50 salmon died and none had escaped. I'm not questioning the minister's statements, but I want to see, fishers want to see, and the community want to see the information that he's basing his comments on. At the end of the day, we want to be satisfied that we know the truth. Will the minister do his job, use his ministerial discretion, and table all the Jordan Bay inspection site reports from January 5th, 2008 up until today?
The Honourable Minister of Fisheries and Aquaculture.
Thank you very much, and indeed, we will be tabling a report on exactly what it costs the department to follow up on erroneous reports of floating salmon in the harbour, salmon piled up on the beaches, and all these things. We, again, as I said the other day, we put the helicopters up twice to review this place, took photographs of the area. Indeed, there was none. And it's a repeated story over and over again. Costs the department thousands and thousands of dollars to investigate things that aren't real.
The Honourable Member for Queens Shelburne.
Thank you, Mr. Speaker, and thank you for the response. Unlike the minister, I put my boots on January the 19th, and I walked that close line. I didn't get in a helicopter. I have photos that I will table for the House that doesn't look like minimal debris to me. Mr. Speaker, the aquaculture industry is still growing. It's going to be vital for our rural communities, and that's why we need to be transparent as possible and do things right. We don't need government secrecy against the people in the community who are on the ground, not flying around in helicopters. There are pictures of ghost nets on the shore, feeding tubes all over the place, salmon pens torn open, and claims of dead fish loaded on a truck ready to be discarded. My question is, how can the minister dismiss the concern of the community when they are the ones taking the pictures and walking the shorelines?
The Honourable Minister of Fisheries and Aquaculture.
Thank you again for the question. Indeed, we had enforcement staff on site through the whole process. The company cleaned up the debris was on the coastline as they were supposed to do, and under the Act they have to do, unlike any other pollution or any other things that go on the shore of any harbour in this province. It's the only industry that has to clean it up, and it's the only industry that we have the ability to enforce. And when you go to the debris, you talk about debris. Where I was in Digby, never seen sign or you or anyone else there.
Order, please. Order, please. Like to remind. Order, please. Like to remind the Honourable Minister not to refer to members opposite directly. The Honourable Minister of Fisheries and Aquaculture.
I withdraw that, Honourable Speaker. On the day I went to Digby to clean up in the harbour, and indeed there was a couple of abandoned fish pens there that had been there because of a bankruptcy. And that day, including those, we took several tons of product off of the beach. 95% of it was from commercial fishing industry. We have no authority to get it cleaned up. We cleaned it up anyway, and the Aquaculture Association of Nova Scotia, through and Clean Nova Scotia, organized it. The mayor for the area was there at the time, and the fishing industry helped us clean it up, which we want to thank them for.
The Honourable Member for Dartmouth East.
Thank you, Mr. Speaker. In November of last year, Dr. Wojtek Gregus retired after trying to sell his family practice in Dartmouth for 2 years. Another doctor in the same practice retired at the same time. The departure of these two family doctors left more than 3,000 people without access to primary health care. My constituent, Alina Zukovic, is now at a loss. She is in a desperate situation, Mr. Speaker. Her family of 5, including her 82-year-old mother with extensive health challenges, has nowhere to turn. Ad hoc visits to walk-in clinics and emergency rooms are not providing a sufficient standard of health care for the Zukovic family. My question through you, Mr. Speaker, to the Minister of Health. Will the Minister work with my office in Dartmouth East to find this family the primary care physician they so desperately need?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I appreciate the question asked by the member. Of course, Mr. Speaker, we recognize the challenges of those Nova Scotians who don't have a primary health care provider, and we are working with our partners, the Nova Scotia Health Authority, the IWK, with the recruitment initiatives. We're also partnering in unique ways with other departments, like the Department of Immigration, to help establish new streams for international recruitment to provide those primary health care providers. We're also working to expand collaborative care practice, Mr. Speaker, but for the member opposite in the specific cases referenced, if he wants to reach out to my office, we'll certainly endeavour to work with him to the best of our ability, but we can't force physicians to take on specific patients.
The honourable member for Dartmouth East.
Thank you, Mr. Speaker, and I certainly appreciate the minister's response. As the minister is aware, during budget estimates last year, the Collaborative Care Clinic in Dartmouth East with 2 new nurse practitioners was highlighted by this government. These nurse practitioners have been at capacity with patients since last summer. A new clinic in Dartmouth South has been so inundated with family doctor inquiries that it has stopped answering the phone. Residents of Dartmouth, quite frankly all of Nova Scotia, they deserve a better standard of primary care than what this government in the past 5 years has been able to deliver. So my question is this, Mr. Speaker. When will the minister and the Premier act with a sense of urgency and clearly communicate a plan to Nova Scotians that will attract and retain more doctors to our province? Thank you, Mr. Speaker.
Minister of Health.
Thank you, Mr. Speaker. Indeed, we are acting. We came in 2013, Mr. Speaker, to establish a provincial health authority that allows us to assess and collect information in a way that we were never able to do before, to ensure that Nova Scotians from one end of the province to the other receiving access. Mr. Speaker, we now know, based upon establishment of the 811 Need a Family Practice List, Mr. Speaker, as much as people like to criticize or complain about the size of the list, Mr. Speaker, at least now we know as a province where the needs actually are, Mr. Speaker, for primary care needs. In fact, historically, people have thought that the only needs for family physicians were in rural Nova Scotia, where we actually now know that about 40% of the need is actually in the Halifax region, the Halifax-Dartmouth region. So now we're able to actually focus on a need that nobody knew this province actually had prior. So we're collecting the data, making the decisions, and acting in the best interest of all Nova Scotians.
The honourable member for Pictou East.
Congratulations to the minister who now knows the need exists, just like we find out every single day, Mr. Speaker. Imagine having a serious underlying medical condition and contracting bronchitis and needing urgent medical care. You call your family doctor's office, it's closed due to some computer upgrades. This is what happened to a young lady who reached out to me this week. Thankfully, she was able to get the medication she needed by visiting a walk-in clinic. Now, needless to say, with her complex underlying medical condition, she was nervous to get prescription filled from a doctor who didn't have her full medical history. So my question for the minister today is, how are complex medical cases being managed for patients who don't have a family doctor?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I thank the member for the question. Indeed, made reference to the computer upgrades, the technology upgrades taking place at the physician's office, the regular family physician that constituent had. Indeed, that highlights the fact that, Mr. Speaker, we have a number of technological initiatives with family physicians to upgrade their systems, but also, Mr. Speaker, throughout our entire healthcare system to standardize our health records, to have one patient, one record that can be shared both with our primary care practices and family physicians through the system in access into our hospitals and with specialists, Mr. Speaker, to ensure that the patient history and medical information is available where they need it, when they need it, by the professionals providing that care.
The honourable member for Pictou East.
Mr. Speaker, it sounds so rosy, doesn't it? It just all sounds so rosy. But to make matters worse for this patient, she needed to get a form filled out so she could access her paid sick leave. The walk-in clinic wouldn't fill it out. By the time her family doctor's office finally reopened after the computer upgrades, 3 weeks to get an appointment, Mr. Speaker. 3 weeks to get an appointment. She's on bed rest. She's very sick already. She can't work because she's too sick, and she can't get the forms filled out to get paid. Now, here's the kicker, Mr. Speaker. Here's the kicker. This young lady works for the very healthcare system that we're talking about today, with people with very weak immune systems. So if a healthcare professional with a family doctor can't get a form filled out, what hope does somebody who doesn't have a family doctor have?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and again, thank the member for the question. As I've highlighted previously, Mr. Speaker, we are working with our healthcare partners, with the Nova Scotia Health Authority, the IWK, again, indeed, partnering with other departments in ways that has never been done before to establish new immigration streams, to increase our recruitment efforts for international physicians. We're expanding our incentive programs for tuition, expanding it across the province, Mr. Speaker. So all these initiatives to help.
Order, please. Time allotted for oral questions put by members to ministers has expired. We'll now